Well, the news of COVID-19 vaccines being available as early next week sounds great to many on the surface. You know, not everybody's going to be lining up to get the vaccine. We're joined by Adam Rizzieri, a marketing expert, about how marketing for the vaccine will work. First of all, not everybody is of one mind, are they, Adam?
As you can expect, when you see this kind of information hit the market, there's different types of consumer attitudes that health marketers have to address. Of course, you're going to have those vaccine believers. Those are your earliest adopters, the ones who are happy to get that needle in the arm. But then you have those who are cautious. You have people who are kind of relaxed about it because they don't really know much about it, but they're easily influenceable. But then you have this group of unconvinced people who are going to be reluctant to take any good advice that's given to them, wherever that advice may come from.
So does it take a bunch of different types of marketing then, where you're marketing one for availability because people are just ready and willing, yep. And then you've got another one where you're just trying to convince them by any way possible, and that could be tugging at heartstrings or, like you said, talk about the severity and things like that?
There's a ton of access points for where information may come and ultimately how you connect with people that might be your vaccine consumers. But at the very top is kind of where it starts. It starts with governments and supranational organizations that play this central role in educating these groups of people that ultimately are going to see information either through healthcare systems, advertisements, online. You'll see information come through the traditional news media, of course, but eventually all this information is hitting the market, and it's doing so because it's got huge budgets, typically publicly funded, pushing information that eventually trickles down to your personal physician, friends, and even family members who become sources of information. The reality is 4 in 10 Americans right now still are hesitant or just don't want to get a COVID-19 vaccination. And the biggest concern that marketers have to address, and they could address this through case studies, they could address it through referencing just the history of research and science behind the class of viruses called coronaviruses. But it's this fear around the speed of development, the rapid ability for us to create this vaccine in less than a year is the most commonly cited reason among those who say, you know what, I'm not quite sure if I want to vaccinate. If we can speak to just the history of the science behind the research here, because the reality is that this research goes back to the mid-60s. Coronavirus hit us this year, but the class of coronaviruses has been around in science for quite some time. So understanding exactly what the objections are, answering those objections with actual facts and science to help mitigate perceptions of risk, that's going to be the best way to really overcome a lot of the objections that hit. In the market right now, you've got about a quarter of people that are just kind of wanting to not be the first one to get vaccinated, but they're okay being like the second or third. They want to wait and see what happens. And ultimately just kind of leveraging information through the channels that exist to share that the benefit far outweighs the risks of vaccination.
That is really interesting. That's Adam Rizzieri, a local marketing expert on how to market that coronavirus vaccine.